Hi, I'm Melanie from UWorld. We're looking at next-gen practice questions from the UWorld question banks. Now we have an overview of the matrix multiple response NGN question type. Okay, so matrix multiple response is another one of those question types that's going to be available at NGN starting in April. It is a little intimidating to look at because it's a grid with lots of boxes to click through, so it can be a little scary, but we can kind of break it down into a couple columns at a time. This one is just a sample. It's a silly, simple topic, but I think it's helpful kind of to talk through how to respond to these questions. So starting off, we're asking the student to compare types of fruit, and then for each characteristic below, specify if it's characteristic of lemon or apple. So pretty straightforward. An apple, it is often available in red varieties, and that does not apply to lemon. So we'll check that for apple. And then for primarily yellow, I wouldn't say that's related to apple, but I think it applies to lemon. Like that. And then I think the next slide will actually kind of fill in all the answers, which is helpful. And then we can click the next one and see the grading here. So we were correct that lemons are primarily yellow. They are definitely a citrus fruit. And like apples, they both grow on trees. So this one really, like I said, is your comparing one feature to multiple, often like disease processes or complications. A lot of times it's like, what does hyperthyroidism versus hypothyroidism look like? And it's a column like that. The scoring for this item is plus minus because you could go through and click every single option. They do have to remove points when you select an incorrect answer. So you selected here 5 correct answers, which is great, but then there was 1 incorrect. And the total score for this one is 4 out of 5 points, which is just giving you partial credit of the value of that one question you're working on. Let me flip over and we can see one in the actual main bank. So here's one that we can answer that's a lot more clinically focused. This is the same case study that we looked at in some of the other items. It's a lady who came in for DKA. So we talked about all of her symptoms that are related to DKA here. And then we're comparing, contrasting, kind of differentiating the diagnosis, I think is how they use it in like medical terms. They differentiate diagnoses. So we'll kind of go through here column by column or row by row. Really, it's the way that they've described it to us is like a set of like each column is a SATA question, a select all that apply. And then here you can see it says you must have at least 1 response for each column. So I would kind of treat it as 3 SATAs all squashed together here. But starting off DKA, we'll just see if each of these applies to it. So DKA, absolutely polyuria, that's very common. That's a good sign of DKA. Vomiting is common. They're definitely tachypnic because they're acidotic. Tachycardia for sure. Hyperglycemia, of course. And then they're having abdominal pain. That's common with DKA. Ruptured appendix, polyuria, probably not related. Vomiting for sure. Tachycardia, their body's under a lot of stress. Oh, tachypnea. Tachycardia, a lot of stress, especially pain with appendicitis can bring up that heart rate. Hyperglycemia, probably not related to the appendix. Abdominal pain, for sure. And then the other one we're comparing is ruptured ectopic pregnancy here. Polyuria, I mean, somebody's pregnant. I feel like that's appropriate, but I'm not sure if that's just in the beginning. Go ahead and click it. Vomiting, absolutely for pregnant women. Tachypnea, tachycardia. If they've ruptured, they are going to be bleeding out. So absolutely these signs of blood loss. Tachypnea, tachycardia. Hyperglycemia is probably not related to this one. And then abdominal pain for sure. They are in active labor. So we'll go ahead and hit submit here. And then let me flip over to the other one because the answers here aren't available until you finish it out. And we're just looking at the one item. So here we go. So we'll kind of look through how we did. Because it is such a big matrix, there's 14 points actually available here. And again, they're all partial points. It's not like this one question is worth 14 points and the other question is worth less than that. Every question is worth the same amount. And then this is just you're getting partial credit within that amount. So if each one was 1 point, you'd be getting a a fraction of that point. So here we were totally correct with our symptoms of DKA, knocked those out of the park. Appendix did great, except this one it looks like we didn't select, and we should have selected for tachypnea, which does make sense because if they're having pain, if they're having an acute infection, absolutely we would expect them to be tachypnic. So that's one we missed right there. And then over here are our correct options, and then we accidentally clicked this one when we shouldn't have. This is an incorrect option. So when you talk about the scoring, because it's one where you can select a whole bunch of options and it's not limiting you, they do subtract points when you select the wrong option. So the total number of available points, it's 1, 2, 3, 4, 5, 6. There's 14 down here. So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. And then the 2 we lost were this one and, oh, no points were subtracted here. That's what I'm missing. Is that we gained points for these 6, 7, 8, 9, 10, 11, 12, 13, and then we lost a point here. So that brought us down to 12. So that was our score of 12 out of the possible amount down here. So that's how we score it. And then that's how it's displayed in the score report for UWorld. And then it gives you a nice little infographic as well if you want to know more about like plus, minus scoring, which is what applies to these data items, so that you can pop up there as well. But that wraps up for today. Whether you're taking the current NCLEX or the next generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN, and to start practicing today. Thank you.